The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. This is Sherry Lynn Phelps, Agronomy Manager with Sask Pulse Growers, and I'll be the moderator for today's webinar. We also have Andrea Lauder, our Communications Manager, who's done all the heavy lifting in terms of organizing the webinars and is looking after the functioning and administration. Without her, the webinars just wouldn't be possible, so a big thank you to Andrea. And now to our participants, a big welcome to the second Pulse webinar for 2019. Before we get started, I'm just going to give a bit on the administration. So to get CCA credits for today's webinars, you must be watching it live. For those who attended the webinar, Andrea will send out an email after the webinar requesting your CCA number. At this time, you can respond with it. And if more than one person is watching from one computer, you will need someone to verify those in attendance, and all can be included for their CCA credits. Webinar will be recorded and posted to the SPG website for future viewing for those unable to attend or for those who want another look at what was addressed. Videos of the webinars will be posted under our resource tab on the Saskatchewan Pulse Growers website. For today's webinar, all participants will be muted. We will be happy to take questions at any time during the presentation. To ask a question, please type in the question into the box that's located on the GoToWebinar dashboard. For today's webinar, we will hold all questions till the very end, and then they will be addressed. Today, we have Dr. Barb Ziesman, who is speaking to us from Regina. Barb is the Provincial Specialist of Plant Diseases with Saskatchewan Ministry of Agriculture. She grew up on a farm near Edmonton, Alberta, where she attended the University of Alberta and received a PhD in plant pathology with a focus on sclerotinia stem rot of canola. Barb moved to Regina in 2015 to begin her career with the Saskatchewan Ministry of Agriculture and has been in her current position since May of 2016, which means she just had her 3-year anniversary. Congratulations, Barb. Barb will be focusing on disease management in pulses and what we can expect this year. She will start with seed quality and seed treatments and then move into foliar diseases, where she will talk about understanding the differences in life cycles to help us understand best management strategies. She will then finish up with talking about managing development of fungicide resistance with a special emphasis on Ascochyta and chickpea. I am now going to turn the controls over to Dr. Ziesman.
Perfect. Thanks, Sherry Lynn. So yeah, as Sherry Lynn mentioned, I do have a variety of topics today. A lot of it is going to be kind of focusing on the basics of plant pathology and the reasons behind why we do certain things when we are managing diseases. So kind of looking at plant diseases and kind of going back to the basics a little bit. When we talk about disease in a general sense, we're often referring to anything that could go wrong with the plant. So any abnormal state of that plant. So often environmental injury and other physical injury, as well as diseases that are caused by living organisms, are all lumped together. But from an agronomic perspective, when we talk about diseases, we're talking about the ones that are caused by living organisms or pathogens. And the majority of pulse crop diseases and field crop diseases in general that we deal with here in Saskatchewan and in Western Canada are caused by fungi or fungal-like organisms. And if you've ever heard a pathologist speak before, we spend a lot of time on the biology of the organism. And the reason for this is it's actually really important. The more we understand about how the organism survives, how it causes disease, and the conditions that favor disease development, the more equipped we're going to be in terms of actually managing that disease. And when we talk about that interaction, we often refer to the disease triangle. The disease triangle has 3 points: the host, the pathogen, and the environment. And it's the interaction of these 3 points that influence how much disease we get. So from the host perspective, we're talking about whether or not the host crop is susceptible, which can be influenced by the crop type and the pathogen that's present and whether or not it's going to actually result in disease. But this can also be influenced by the genetics, so whether or not it's genetically resistant to that disease. From the environment side, we're talking about whether or not the conditions are favorable to drive disease development. And this is the aspect of the disease triangle that we have the least amount of control over. So we can't control the temperature and we can't control how much rain we get, but there's things that we can do in terms of our agronomic decisions that determine whether or not the canopy and the environmental conditions within that canopy are going to favor disease development. So we can think about seeding rate. So is it a dense canopy or a looser canopy, more open canopy? Those are going to influence the microclimate within that crop. And the third point is the pathogen. So when we talk about the pathogen, often we talk about whether or not it's an aggressive pathogen. So is it capable of causing the disease? We talk about the amount of the pathogen. So the more pathogen that's present, the more disease that we're going to see in the field. But we also talk about whether or not that pathogen is going to be sensitive to the management strategies that we're going to use. So when we talk about diseases, most diseases that we deal with are going to benefit from an integrated approach to disease management, which means that we're using more than one strategy. And some of the strategies that we can use include crop rotation. So crop rotation is really focusing on that pathogen side of that disease triangle. We can use rotation to break disease cycles and to minimize the amount of pathogen or limit the amount of pathogen that's in the field to cause disease the next time a susceptible crop is growing. Variety selection focuses on the host, and it involves selecting the most resistant variety that is out there to make sure that we limit the susceptibility of that host to the disease and to that pathogen infection. Seed quality, this is a really good way to make sure that crop gets off to a good start, to ensure that we have strong, vigorous plants and a uniform crop stand. So that's going to help it withstand infection by diseases through the growing season, but it's also going to help with some of our fungicide timing and some of our management decisions as well. Seed treatments, this can also help get your crop off to a good start, but also seed treatments will help us protect against these early season diseases. So seedling blights, seed decay, seed rots, and early season root rots can all be controlled or suppressed by the use of seed treatments. Sanitation, so this is something that we talk a lot about when we talk about canola diseases such as clubroot, but really it's a tool that we can use to minimize the introduction of any pest that isn't present in your field. So it's something that you can do to prevent any introduction of anything that you're not already dealing with. Crop scouting. This is going to be really important when we start making our in-field fungicide or other management decisions, but it's also a really important tool that we can use to guide future decisions. So if we conduct late season scouting and get a good understanding of what diseases were present, or if you use check strips to get an idea of whether or not your fungicide application was effective, you can use this information to guide future management decisions. Foliar fungicides, which I'm going to talk quite a bit about, and then also harvest considerations. So one tool with harvest considerations could be residue management. So making sure that your residue is finely chopped and evenly spread is going to help with that decomposition. So you're going to, especially if the pathogen overwinters on the residue, you're going to make sure it decomposes faster. So you're going to make sure that you have less pathogen present in that field to cause disease the next time you grow a susceptible crop. Today, I'm really just going to be focusing on seed quality and seed treatments, as well as spending a lot of time on foliar fungicides, so how to make those decisions, but also how to protect the foliar fungicides and minimize the risk of insensitivity or resistance. So with seed quality, we want to choose the best quality seed that we have. And this is, again, a way to get that crop off to a good start and make sure that it is growing strongly and vigorously. And we do this by getting our seed tested. So often when you get a seed test, you're going to be looking at germination and vigor, but we also recommend getting a disease test. So a disease test will actually give you an indication of all of the seed-borne pathogens. So these are the pathogens that are living on the external part of the seed, or maybe they infected the seed and are living within the embryo. So this gives you an indication of the disease potential within that seed lot itself. And when you get these results, you're going to get them back as a % infection. And you'll see that percent infection for all of the pathogens that are present on that seed. You can use this information to decide whether or not you want to use that seed lot. So if they're very high, you may want to look at a different seed lot, especially if you're also seeing a reduced germination. But it can also help you make those decisions of whether or not you want to use a fungicidal seed treatment. So if you're seeing moderate levels or low to moderate levels, you may want to use that seed treatment to protect that seed and those developing seedlings from infection by those pathogens. So a seed test is going to be really informative, but you also want to think about your field history, because a seed test isn't going to tell you the levels of soil-borne or residue-borne pathogens, which can also cause some of those seed decay and seedling blight diseases. So the best way to get an understanding of the pressure from within the field is looking at the field history and what happened in previous growing seasons and the diseases that you saw then. When you use a seed treatment, the efficacy is going to depend on a number of things. So the first is the choice of the product. So you want to make sure that you are selecting a product that's going to give you control or a strong suppression of the pathogen that you're trying to control. When you're applying it, you want to make sure you get good coverage, especially if you're using a contact fungicide. If you're not covering that entire seed, you're going to have limited effectiveness, a limited ability to actually protect that germinating seedling from infection by the pathogen. And the other one is environmental conditions. So environmental conditions can influence whether or not you'll see infection, so whether or not the conditions will favor disease development, but they can also influence the susceptibility of the crop. So seed treatments, when you use them, they're actually only going to be effective for a finite amount of time. If your seedling is slow growing due to adverse environmental conditions, and we are seeing that in some fields this year where crops are slower growing than if conditions were optimal, this means that that crop is going to stay in a susceptible stage for seedling blight or seedling diseases, and they're going to be susceptible outside of the time when the seed treatment is effective. So you can get infection of the seedlings by the pathogens even though you used a seed treatment, just because that infection is occurring when that seed treatment is no longer effective. And we did see this in a number of fields in 2017, and typically with fusarium crown or fusarium root infections, like shown in this picture here. So if you're seeing poor germination or weak seedlings, maybe go out and take a look at what's going on and see what the root system looks like or what the seedlings look like to see if there's any evidence of seedling diseases. So over the last couple of years, SaskPulse has actually contracted someone to contact all the seed testing labs to get an understanding of the seed quality. And so these results are courtesy of 2020 Seed Labs, Discovery Seed Labs, and Prairie Diagnostic Seed Labs. And this gives us an understanding of the 2018 seed quality. So when we look at seed quality, we're going to see that there's two different numbers shown. The first is percent PFS, which stands for percent pathogen-free samples. So this refers to the percentage of samples received by the labs that did not have the pathogen present. The second is your mean percent infection. And this number is similar to the number that you would get on your seed test. And so what we saw is in 2018, our seed quality was actually very good. And that's probably a large part due to the environmental conditions that we saw in 2018. We had a drier season in a large part of the province, which resulted in lower disease levels. So for most of the diseases here, for both peas and botrytis, we saw that the percent pathogen-free samples was actually above 94%, and the mean infection was 1% or lower. So that is fairly low, meaning that most of those seeds are really good quality. With Ascochyta and field pea, we saw slightly higher infection levels, so only 60% of the seeds were pathogen-free samples, but the mean infection was still low. It was only 2.4%. And our general rule of thumb for Ascochyta in field pea is that if the infection is lower than 10%, or is a 10% infection that really triggers that seed treatment decision, independent of field history or environmental conditions. So we had really good quality. When we look at chickpea, we also saw that disease levels were very low. I did highlight the Ascochyta blight in chickpea just because this disease is a little bit interesting. This is one of the diseases that has a higher seed to seedling transmission rate, which means that our recommendations or our thresholds for seed treatments are going to be a lot lower because it has an ability to move within the seed treatment or the seed row and has an ability to cause increased level of diseases when it is present on a few seeds. So we saw about 75% were pathogen-free seed or free samples, but the mean infection rate was 1.2%. Our recommendation is that if your seed lot is above 0.3%, our recommendation is to try to find a better seed lot. And if you have infection rates between 0 and 0.3%, we do recommend using a seed treatment to protect from that early infection. So moving into kind of bridging the gap between seed treatments and foliar fungicides, just want to spend a couple minutes talking about fungicide types. So when we think about using a fungicide, our goal is to protect that healthy plant tissue from infection by the organism and prevent disease symptoms and prevent yield or quality loss. So often we are using these proactively. We don't have any fungicides available that will cure a plant of disease. So once you see symptoms, once you see damage, we can't reverse that effect, but we can prevent it and protect that healthy plant tissue. If you see some lesions on a leaf, you can use a fungicide to protect the tissue that has yet to be affected. And we often use two different types of fungicides. So the first is contact, which is also known as preventative fungicides. These fungicides actually stay on the surface of the plant. So they don't actually move into the plant tissue, so they're not systemic. They stay on that surface. So for them to control the disease, they need to be on that plant before the pathogen is present. And they need to be on that plant before the pathogen actually causes infection. So they need to come into direct contact with that pathogen spore or mycelium. So often when you're using these fungicides, you do need to use them. You may, if disease pressure continues and environmental conditions favor disease development, you may need to apply them more than once to ensure that you're protecting that new tissue as it continues to grow. The other type are systemic fungicides. So these also can be called curative fungicides. So these ones have the ability to move into the plant, and they have some systemic activity. When we talk about fungicides, they're not as systemic as some herbicides. So some herbicides can move up in the xylem, but they can also move in the phloem. And fungicides, they don't have that ability to move in the phloem. So most fungicides that we have will have local systemic activity, which means they can move throughout the leaf. And some of them will have some ability to move in the xylem, so that water transport system. So you'll get some movement up into the plant as well. And these can provide protection when the pathogen is present and can provide some protection even after infection occurs. When a pathogen infects a plant, it goes into what's called a latent stage. So the pathogen is going to move into the tissue, and it's just going to sit there for a while it's growing, but we're not seeing any symptoms at this point. So during that latent period, before we see symptom development, these systemic fungicides can provide control, so they can prevent symptom development. But once you see symptoms, then we're not able to reverse that damage. So when you're thinking about applying a fungicide, scouting is going to be your best friend. Scouting should really occur weekly from when your crop starts to emerge all the way to maturity. When we get into periods of time where that crop is more susceptible or has a highest risk of vulnerability for diseases, then we need to increase that intensity of scouting, particularly when environmental conditions favor disease development. And most of the fungal diseases that we deal with as foliar diseases are going to be favored under warmer, wetter conditions. So though we're in dry conditions now, we still want to be looking to see what's happening in that crop and be really monitoring the environment, because we all know that it can change very quickly. And also when you're scouting, it's important to know what you're looking for. So what you're looking for scouting is really going to be dependent on the biology of the organism and the type of disease that you're working with. And there really are two major types of diseases that we have. The first is a monocyclic diseases. So these are diseases that only have a single infection cycle per season. So they only have a single spore stage. So once infection occurs, disease levels increase quickly, and then they level off. So you're not getting multiple spore stages, multiple infections per season. With these types of diseases, we need to be extremely preventative. So fungicides need to be applied prior to symptom development. Once you see symptoms, that means that infection cycle has already been completed. For these diseases, we really need to be scouting for the environmental conditions. And an example of this is white mold or Sclerotinia stem and pod rot. And so for these, when we're thinking about scouting, we're thinking about what the environment is doing. So is the environment favorable for disease development? Is there a history of the disease within the crop? So what is the field history? When we're thinking about fungicide application for monocyclic diseases, particularly white mold, we also need to make sure that if we are applying a fungicide, that we're doing it in a way that we're going to get effective control. This disease most commonly occurs later in the season after canopy closes. So this can actually limit our ability to manage the disease effectively with fungicides. So if you think about lentils, when that canopy closes, it becomes very tightly knit. So it is very challenging to get that fungicide down within that canopy. So if you are using fungicides and there is an increased risk for white mold, do it right before canopy closes and make sure that you are getting that good coverage into that lower canopy. You want to protect those lower tissues as well. The other type of disease are polycyclic diseases, and these are actually the most common foliar diseases. These are the diseases that you see, they might start at low levels, but you see that they increase really quickly throughout the season, particularly in wetter years when conditions favor disease development. So polycyclic diseases actually have more than one infection cycle per season. So they release multiple spores or multiple spore stages. So you'll get a symptom, you'll get a lesion on the leaf. Within that lesion, the pathogen will create more spores. Those spores can then be released to cause infection of new tissue. So you get that exponential increase in disease levels. And with these diseases, the plant is actually going to be susceptible for a longer period of time. When we think about controlling, we're often not trying to prevent any symptoms. We're trying to control or manage the disease before too many disease cycles have occurred. So we're trying to protect the tissue that if it does become disease, it's going to cause the most economic yield loss. So we're going to try to protect from photosynthetic tissue loss, but also from the symptoms that are going to cause the most damage to the plant. So when we're working with polycyclic diseases, these are the diseases that you really need to get into the field and scout to see what's happening. So we're going to be scouting for symptoms, and then based on what we're seeing in the field and based on what we're seeing in the environment, then we're going to make that decision as to whether or not we're going to apply a fungicide. So a fungicide really does need to be applied before too much damage. So if we think about Mycosphaerella blight, if that disease stays in the bottom third of the canopy and we're not seeing it moving up or affecting the stem, then we're not going to see a lot of economic yield loss. So in those situations, you may not need to apply a fungicide. But if we're seeing that it's starting to move up into those top 2/3, that may trigger the fact that you're seeing high levels of disease, and you might want to apply that fungicide to prevent yield losses due to the disease. So some of the examples for polycyclic disease include chocolate spot of faba beans, Mycosphaerella blight of peas, but also Ascochyta blight in lentils, in chickpeas as well. And another example is Anthracnose of lentils. And I'm going to spend a little bit of time talking about this one as kind of a good example or a case study of polycyclic disease management. So anthracnose is caused by a fungus known as Polycyclic truncatum. And so this disease, like most fungal diseases, is favored by wet conditions. So it's first going to cause lesions on the leaves, and then we're going to see lesions move onto the stems. And it's when we get the lesions on the stems that we're going to see the most impact on yield. So when we're applying a fungicide, we're trying to protect those lower stem lesions to protect the yield potential of that crop. The pathogen overwinters as microsclerotia, which are these little black structures that are present on the bottom picture. The microsclerotia in the spring are then going to be splashed onto the leaves and the stems by rain. And when they come in contact with that healthy plant tissue, then we're going to see that initiation of infection. And again, it's going to be favored under warm and wet conditions. When we get that lesion development, whether it's on the leaf or on the stem, we're going to get new spores produced within that lesion. Those lesions are then going, or those spores are then going to be rain splashed onto the healthy tissue to cause more infection. So in terms of management, a diverse crop rotation is going to be very helpful. So this disease is residue-borne, so it survives on the infected residue. So crop rotation will help reduce the amount of residue present and the amount of pathogen that can cause infection. We want to use resistant varieties. So there are resistant varieties on the market, but it is important just to keep in the back of the mind that there's two races of the pathogen, and these resistant varieties really only protect against one of the races. And the other one is application of foliar fungicides. And it's really important that we apply these foliar fungicides before canopy closure, just to make sure that we're getting that good coverage. So when you're thinking about your risk for anthracnose, you want to be scouting and thinking about what's actually going on in the field and what's going on in the environment. And on the SaskPulse website, there's a really good risk assessment checklist that you can use. And so there's different questions. So there's questions about the plat stand. Is it thin, moderate, normal, dense? The number of days with rain in the last 14 days, the 5-day weather forecast, and what you're seeing in the field. So what are the symptoms of anthracnose? And this can also be used for Ascochyta blight. And so based on how you answer these, you're going to get a risk factor. And based on that total risk, it's going to give you an indication of whether or not you should consider applying a fungicide. So if you're seeing a risk factor total number of more than 50, it gives you an indication that maybe you should be considering applying a fungicide. And so it's a good tool to help you make those decisions. Fungicides are going to be best applied when you're starting to see those foliar lesions, but before you're seeing significant lower stem lesions. When conditions are favorable, that first application is going to be best kind of in that early or that 10 to 12 node stage to early flower. And really that timing is going to be dependent on what the environment's doing and what you're seeing in that field in terms of your scouting. Again, you're trying to protect that lower stem tissue and protect those stem lesions, or protect against those stem lesions. In situations when environmental conditions are favorable, like we saw in 2016, there may be a need for a subsequent application. So once you've applied your fungicide, you're going to want to continue scouting to see what's happening and monitoring what's happening with the environmental conditions. So if you have high disease pressure and the environment favors disease development, you may want to consider doing a subsequent application. But that's really going to be dependent on what the environment does this year. So when we think about fungicides, something that we also need to keep in our mind is the risk of fungicide resistance or insensitivity. And often we call this insensitivity. And the reason for that is with some fungicides, it's not, the pathogen can have a reduced sensitivity, which means that it's going to take more of the fungicide to actually get the same level of control. And so that level of insensitivity can actually increase over time or with selection pressure. And sometimes this may not be present or be very obvious in the field until it has increased the level where now that pathogen has become more resistant. So now that fungicide is no longer effective in controlling against that pathogen or that fungus. And the best way to protect against fungicide resistance is through fungicide stewardship. So we want to think about what we're doing and how we're using fungicides. So the first one is make sure that you are actually only using a fungicide when you need it. So when there's evidence of disease risk. When you are using a fungicide, think about using multiple modes of action. So different modes of action are going to target different biological systems within that pathogen. And so the more modes of action that you use, the harder it is going to be for that pathogen to be able to overcome it or develop resistance to it. And this can occur within a single product, but it can occur if you are applying multiple applications. So if you are making more than one application in a season, make sure that you are using different modes of action or different chemistries. And if you look in the guide to crop protection on the product pages, many of them often indicate what the maximum number of times that you should apply. And some of this is related to fungicide stewardship. So you want to make sure that you're using the appropriate fungicide for the disease that you're trying to control. So you want to make sure that you're actually selecting a fungicide that's going to give you control against that disease or that pathogen. You want to follow label rates. Often it's tempting to reduce label rates, but what you could be doing is actually by using a lower rate of that active ingredient, you could actually be encouraging insensitivity. So you're not going to be potentially managing the ones that are not going to be sensitive to that lower rate of the active ingredient. And the other tool is using an integrated approach. So using some of those other disease management tools that we have available to us, such as crop rotation and resistant varieties, to actually reduce that disease pressure or the risk of disease. And by doing that, you're going to limit the years that you actually have to apply a fungicide. And so our fungicide resistance is actually something that we do have here in Canada and in Saskatchewan. And so an example of a disease where we are dealing with fungicide resistance is Ascochyta blight of chickpea. The Ascochyta blight in chickpea is caused by Ascochyta rabii. So this is a different disease or different organism than Ascochyta in peas or lentils. So this issue is something that is really specific to chickpea, or at least the example that I'm going to be talking about is specific to chickpea. And so this is the most economically important disease of chickpea in Western Canada. It can cause seedling blights, but it can also develop really quickly within the growing season and cause significant levels of yield loss. And what they have identified now is that the majority of the pathogen population is resistant to strobilurine fungicides, and these are the group 11 fungicides. So there may be really small amounts of the pathogen population that may be sensitive, but the majority is actually going to be resistant to it. So it limits some of our fungicide selection choices. So when we're thinking about Ascochyta management, that integrated approach is really important. So we want to be aiming for a 3 or probably closer to a 4-year crop rotation. Want to make sure we're selecting varieties with the highest level of resistance. So even if your choices are fair compared to poor, compared to very poor, we want to make sure that we're selecting those varieties that have that fair resistance, that highest genetic resistance available. We want to plant disease or seed that is disease-free. Remember that threshold is very low for this disease. So if you're seeing that percent infection of that 0 to 0.3%, then we want to also be using that seed treatment to add additional protection. Scouting. So we want to begin scouting at that seedling stage. And you want to scout every 3 to 7 days. So especially during that initial susceptible stage. When conditions are favorable for disease development, or if there's a risk for disease development, you want to make your first application of a fungicide at that early seedling stage to slow or prevent disease development. And before you apply additional fungicides, you do want to scout and make sure and use the information in the environmental conditions, but also in what you're seeing during your scouting to guide your application decisions for additional fungicide applications. If you see, if we get in a period that we're getting lots of rain or high humidity, then you're going to want to increase your frequency of scouting after these events as well, because high humidity and precipitation can actually increase disease development. We want to make sure that we're applying fungicides only when they're needed. So this is going to be a tool for managing fungicide insensitivity. So we want to make sure that we're using them when we need them, so that we're not unnecessarily putting selection pressure on the pathogen population. So to do this, we want to scout our crops and use the risk assessment tools available. We want to follow label rates, so we don't want to be cutting rates and putting that additional selection pressure. And if we are making multiple fungicide applications, we want to think about rotating fungicide groups and using fungicides with the lowest risk of fungicide resistance last. So that will be the last product that you choose to use. So what this table shows is it shows all the different fungicides that are registered for Ascochyta blight development. So we have a variety of products, some with the active ingredient azoxystrobin. Then we have products that have multiple modes of action. And so the top part of the chart shows the resistance risk of the different active ingredients or different fungicide groups. So we have really 4 different groups that are in these products. So we have M5, which is a contact fungicide, chlorothalonil. We have group 3 and group 7, which both have a medium risk for fungicide resistance. And we have group 11. So these are the strobilurin resistance, where we do have resistance to within the Ascochyta radii population. And these have a high risk of resistance. So what we want to consider doing is making sure that when we are thinking about a fungicide selection, that we're first of all making sure that we are using multiple modes of action, and that we're trying to manage the risk by including some of those medium and low risks. And because we know that the population does have resistance to strobilurin fungicides or group 11 fungicides, it's not going to be recommended to use a fungicide that only has a group 11 active ingredient. But you could use some of these combination products. If you're applying multiple products, it's good to follow up with a low risk fungicide at the end. So that would be a really good time to use your chlorothalonil products such as Bravo or Echo 720. So I want to leave lots of time for questions. I'm just going to provide a quick summary. So when we think about diseases, again, that integrated approach is going to be really beneficial. It's going to help us reduce that disease level and the disease risk. But once we get into the growing season, then we can really, then we want to be thinking about using the other tools. So at the beginning of the growing season, seed treatments can be effective. And at this time of the year, it's important to actually go out and look at your crop and see what's going on. If you are seeing seedling diseases, use those, keep records, see what's happening. If you want to know what those seedling diseases are, you can submit them to a diagnostic lab, such as the Crop Diagnostic Lab here in Regina, and we can help make those diagnoses to help you with future decisions. And in years where crops are slower growing, we can see some of these seedling diseases occurring after the seed treatments are no longer effective. So even if you use a seed treatment, it's important to look at what's happening in your field. Once we get into the growing season, then we need to start thinking about the risk of foliar diseases. So monitoring the environmental conditions, making sure we're scouting, and making these fungicide application decisions based on what you're actually seeing in the field and the actual risk. When we are applying fungicides, and I know that we have a lot to think about when we're growing crops, but it is really important that we also think about the risk of fungicide resistance. And we think about our product selection, making sure that we are rotating fungicide groups within a season whenever you grow that crop, but also think about the diseases that you're managing in multiple different crops. And think about your fungicide mode of action rotation within those crops as well. So that's all I had prepared formally, but I think there's lots of time for questions if there's questions.
Thanks, Barb. At this time, if people have questions, they can enter them into the questions tab on the webinar toolbar. I've had a couple questions come in so far. And the first one is, going back to your Anthracnose, how quickly after a rain hopefully there's rain in the forecast or rain coming. How quickly after a rain do we need to get fungicide on to protect the plants if we know there's a history of anthracnose in the area?
That's a really good question. It's going to come down a little bit to crop specific as well. So if this is your first rain event and you're not seeing any symptoms on your crop right now, then scout and check your risk there and then make it based on what you're actually seeing within the crop as well. If you have already started to see those lower disease, the lower leaf lesions, and you're just watching for progression of the disease within your crop, that pathogen infection, so once a pathogen is present on the leaf, it's going to have a latent period, I think, of about 24 hours. So you do have a little bit of time. And because you're really trying, especially if you're using a systemic product, it will give you some time after that infection occurs to get some control. So again, make sure that you're looking, you know what's going on within that crop, and then also use that. So you probably have a day or two, but it's important to get out as soon as possible after and see what's happening.
So just relating that to this year, and we have drier conditions and smaller crops, potentially thinner crop canopies, what would be your evaluation of the risk assessment for disease development in lentils? Yeah.
That's a really good question. It's going to differ a little bit from crop to crop, but if we haven't seen any rain and that crop canopy is quite open, it is going to have a lower risk even if we do get a few shots of rain. Because when we think about disease development, that moisture is going to be important for that initial infection, but it's also going to be important for that disease to actually continue, right? So if you get one shot of rain and then it dries out, so that canopy doesn't hold its moisture, it doesn't stay wet, or you don't have that high relative humidity, it may not actually equate to high disease levels. So what I would recommend in that situation is to actually use that risk assessment chart that's available and to kind of take into account how many disease rains you have, or how many rain events that you've had and what you're seeing. So I wouldn't say that if you just got one shot of rain that you should get out and start spraying. I'd really kind of sit back and take a look at how much moisture is within that canopy, and is it actually holding, is that microclimate actually going to be conducive for disease development?
Thanks, Barb. I guess relating to that, when we're thinking of chickpeas, and we know how quickly Ascochyta can become a problem, and there's kind of two thoughts out there in terms of managing that disease in that crop. And one is getting fungicide on early before we see symptomology, and then the other theory, waiting until the first symptoms appear. We know last year we had really low disease pressure with the chickpeas and didn't have much disease throughout the year. Being that this year is dry, what are your thoughts to sort of a realistic management plan for chickpeas this year?
That's a really good question. I'd say it's going to be very similar to last year, that especially because we have had a drier couple to few years in a lot of regions, that disease pressure is going to be lower. If we don't get any significant rain as the seedlings start to develop and we get into that susceptible stage, in a typical field, if you follow if you're on an extended rotation and you haven't seen a lot of disease pressure in that field in the last few years, you may be able to hold off and see what happens with the environment. But if you're in a field where neighboring fields have had Ascochyta blight in the last few years, and you see in the forecast that we might get some rain events, those are situations that you might want to be a little bit more proactive. So I would say that if you're in a situation where you don't have a lot of disease risk or disease history in neighboring fields or within that field, you probably can hold off a little bit. But if you do have some history in the last couple of years, you're going to have a little bit more of a risk. So then I would watch that environment and see if you do have some rain events coming up in the future, then those are ones that you might want to think about applying that initial fungicide when your crop is most susceptible, but hold off doing any other subsequent fungicide applications. The
other question I have relates to seed treatments. And what realistically can we expect under these dry conditions for the efficacy of our seed treatments at this time of the year?
Yeah. If their crops are really slow growing, so I've been into a couple crops that were seeded at the beginning of May, but they're still in very initial stages of growth. They're very small. In some of those crops, we are going to see some seedling diseases develop because there are going to be fungi pathogens that are going to be favored or still can occur. The diseases still can occur under drier conditions when that plant is stressed, and that's what's happening. That's why it's slow growing, is because the plant is stressed. So in those situations, once like 2 to 3 weeks after that seed has been seeded, that seed treatment is no longer going to be effective. So, and we have seen some crops or some samples in this year where we are seeing some of that seedling blight occurring.
So one question I have personally is regarding root rots. We've had a lot of issues with root rots over the last 4, 5, 6 years, and just wondering if you have heard of anybody that has been noticing them at all this year.
So I haven't heard any reports this year, no. But I wouldn't be surprised if we see some. Last year, it did vary across the province of what type of root rots we were seeing. Some of the wetter conditions, we were still seeing some of the Aphanomyces root rots, but we did see in a number of crops the Fusarium root rot. So I haven't heard of anything yet this year, but I would definitely keep monitoring your crops and seeing what's happening, because the potential is there for sure.
Okay. Last question or comment, just maybe you want to highlight some of the provincial disease surveys that will be happening this year, if there's any fields that you're looking for particularly.
Yes, thank you. I completely forgot. So the ministry actually conducts quite a few annual disease surveys. So this year we will be conducting a lentil survey, a pea survey, a faba bean survey, a soybean survey, as well as a chickpea survey. So some of the smaller acre crops, we are still looking for producers, so especially for faba beans. If you grow faba beans and would like us to come and include that in our survey, that would be awesome. So you can reach out to Carter Peru, or you can reach out to a crop extension specialist as well. And Sherry Lynn or Andrea have their contact information. We are also looking for people to be involved in our chickpea survey, which is actually led by Dr. Michelle Hubbard out of Swift Current. And she's looking at a combination of things. So she's looking at Ascochyta blight in chickpea. She's also looking at fungicide resistance. And she's looking for monocrop chickpea fields, but also chickpea intercrop fields. So for example, chickpea flax intercrop fields. So if you have chickpeas or a chickpea flax intercrop and would be willing to have it included in our survey and in the research, please reach out to Carter and we can make sure that happens as well.
Okay. Anybody that gets our Pulse Advisor newsletter, we do have Carter's contact information in there regarding the surveys and what's going on. So if you have agronomists or growers, that would be a great way to get those fields looked at and evaluated. With that, I think we're concluding our webinar here. Oh, we had one more question come in. Just hold on 1 second here. When you saw the higher amount of Fusarium root rot in past years, what were the main conditions that contributed to the root rot developing?
So as we know, root rot can be a complex, right? So we did see Fusarium involved in our wet years. So in 2016, Fusarium was involved, but also Aphanomyces. It was interesting last year, we did see Fusarium root rots come into the crop diagnostic lab in all crops. And a lot of these crops where we saw the Fusarium root rot in the areas that were dry, it was occurring because the plants were very, very stressed. So Fusarium species are actually present in the majority of our fields, and there's lots of different species that can cause the seedling diseases. And so what we were seeing is in the dry years, we were seing that typically we were seeing higher levels of the root rot occurring in the crops that were really stressed. So they're stressed, the immune systems of that plant were compromised, and we're seeing that opportunistic infection. But we do also see higher levels of the root rot diseases with fusarium and other pathogens in the wet conditions as well. And often we see that there's a synergistic effect. So when you get, so if we say that we start getting a lot of moisture and we can get, see some of the Aphanomyces root rot coming in, if you get one pathogen causing infection, and then so if you get Aphanomyces and fusarium working together, we see higher damage as well. But typically under dry conditions, we're going to see a more of a link to higher levels in fields that have a history and when the crops are more stressed.
Thanks, Barb. So thank you to Dr. Ziesman for speaking today about disease management and pulses, as well as a big thank you to Andrea for organizing this session today, and to you participants for joining us. Just a reminder that an email will be sent out so that you can receive your CCA credits. At that time, you can also provide suggestions for future webinar topics or any feedback that you might have. Comments are always greatly appreciated. Thanks again for joining our webinar today, and have a great afternoon.